Medicaid is dying, my friends. It's dying. Now, a couple of things happening. First of all, Medicaid and Medicare are two completely different things. Medicare is for older people. You hit 65, you go on Medicare. All right, you've been paying into Medicare through part of your FICA tax. All right, now Medicaid is for poor people, indigent people, people who need a facility to go to because they can't afford a nursing home or assisted living. And Medicaid is taxpayer funding for that. I was talking to a guy the other day, and this is my concern about it. And I'm going to share with you an article here, which will show you how desperately bad Medicaid is and why you cannot rely on it, and you should not rely on it, frankly. And if you are, I hope you're poor. Let's just put it that way, because if you have assets and you're going to impoverish yourself on paper in order to qualify for Medicaid, that's not good. That's bad. So I was talking to a guy the other day. He was talking to an attorney, drawing up his estate plan. And the attorney was basically advising him on ways he could impoverish himself to qualify for Medicaid. And I just, look, I'm not blaming this guy because this guy didn't know. He's just going off what the attorney was telling him. But man, I was like, this just, it sickens me. It sickens me. The idea that Medicaid is some kind of solution for folks who can afford their own care is bad, because Medicaid is for poor people. And if someone with means, even if they look like they're impoverished on paper, is taking a bed away, there's only so many beds. And if you have means and you're taking a bed, that means someone who doesn't have means is inherently not getting that bed. Or that means we're all going to have to pay more in taxes, because Medicaid is in dire straits. Is all there is to it. And then with what Obama did in 2000, when he did with the ACA, 2010, I think, he bribed a lot of states to open up their Medicaid enrollment, to put more people on the rolls. And he did it by saying the federal government was going to, I think, pay 80% of the initial cost. And I'll never forget people like John Kasich, Republicans who should have known better. But they're so addicted to the federal money that they said, yeah, we'll get on there. We're helping people. I'm doing Jesus's work, Kasich said. But the problem is it came with a stick. The carrot was, we're going to give you some money initially, and then we're going to put it back on you, government, state governments, and they don't have the money for that. And so now John Kasich is out of office. He doesn't have to deal with it. So he was able to say, look, I had all this extra money. I was able to balance the budget, or whatever the hell he was saying. But then he's kicking it down the road to the new governor, Mike DeWine. And I can share with you a case in New York State with Cuomo. And they're like, man, I don't have the money to pay for all this extra Medicaid enrollment. How can I do that? The whole thing is corrupt as the day is long. And the only way they're going to fix this is by raising taxes or getting people off the rolls. That really should never have been there to begin with. But there's no other way around that. And so you have a moral responsibility not to go on Medicaid if you can afford it. I'm telling you right now, you should not do that for sure. So let's dive into this article I read. My man Rob Klein, I forgot what Rob, if I can get this thing to, oh my goodness, man. There we go. Rob is he's a New York resident. He does some kind of long-term care planning, assisted health insurance planning. Rob Klein, Klein, Klein. I interviewed him last year for my podcast. Maybe I'll revisit that. So here's some NBC4 in New York City. Governor Cuomo says ballooning Medicare spending is a major problem for New York. Now you see, first and foremost, the problem here is they're saying Medicare spending. That is not, it's Medicaid. This is where the freaking media is just, oh my goodness, they don't know. So the headline writer is different typically than the actual author who wrote the article. In this case, the headline writer doesn't know what the hell he's doing. That's all there is to it. Medicare is not the issue, it's Medicaid. So Cuomo says ballooning Medicaid spending is a major problem for New York, and it's a major problem for every state. He pinned the shortfall on costly long-term care, increasing enrollment, less federal funding, and payments to financially distressed hospitals. So these two things go hand in hand with the Obama ACA bait and switch. It was such a friggin' scam, such a scam. You should increase your Medicaid enrollment. We'll give you the money for it. And then, but they knew this is where democracy is bad. As long as John Kasich can kick the can down the road to a future governor, he can say, look at me, I balanced the budget, I had all this extra money, and I was able to help people. Jesus told me to. And yet he wasn't doing anything of the sort. He wasn't. He was leaving, and now it's Mike DeWine as a governor with whoever, even I don't care if it's a Democrat. Here we got a Democrat, Cuomo. But Cuomo did this on his own accord. He bought into the ACA promises of increasing Medicaid enrollment. And so because of that, he has increasing enrollment and less federal funding, because we knew for a fact, it has nothing to do with Trump, even though Cuomo's going to blame him, it has to do with Obama. Obama said, we're going to give you the initial funding for this, and then we're going to wean you off come 2017. That's exactly what happened. It's what the ACA said. Anyway, so Cuomo was calling a ballooning Medicaid. See how they say Medicaid in the article and then Medicare in the headline? It's just idiotic. Is calling a ballooning Medicaid spending a major problem in New York. He told reporters his administration is considering spending cuts or further budgetary maneuvers, i.e. tax increases, to address a $3 or $4 billion shortfall for the state fiscal year ending March 31st. A state comptroller's report released Tuesday said the governor should provide more specifics on the shortfall and his administration's response as soon as possible. The Cuomo administration is blaming that. We already talked about that. Cuomo's administration already delayed $1.7 billion in Medicaid payments by 3 days and going into this fiscal year to abide by a spending cap and avoid payment cuts. Let's go. Let's see here. I'm going to go to. We'll go to DuckDuckGo because I don't use Google because I want the truth when I do my search. Medicaid cutbacks. Let's take a look at this. So they cut back. We got New York State sued twice over Medicaid. Medicaid cuts in 2019. Nursing home in limbo as $246 million in Medicaid cuts in New York. Let's see. So you can see that because they're cutting Medicaid. They don't have the money. So this is just New York. If you think it's just a liberal state of New York, you're wrong, man. New York nursing homes in limbo as $246 million in Medicaid hangs in the balance. A plan to significantly change New York State's Medicaid reimbursement model for nursing homes remains up in the air, leaving operators wondering if they could face retroactive cuts to the tunes of millions of dollars. Back in June, New York officials filed a state plan amendment, SPA, for the federal government that would make changes to how it calculates Medicaid reimbursement for skilled nursing facilities. This is why the Medicare for all will never work, by the way. So let me just, the move stemmed from a revision in the state's 2019 budget, which empowered the state health commissioner to create a working group tasked with changing Medicaid case mix adjustments for nursing home. But the state has yet to move forward since it's waiting for approval from CMS, the Centers for Medicare and Medicaid Services. The work group, meanwhile, had its final meeting on June 27th and expressed grave concerns with the changes that the DOH proposed, Department of Health. The DOH is specifically moving to change its calculation for SNN, that's skilled nursing facilities, reimbursement for Medicaid residents from a snapshot system, to one that considers all minimum data set requirements submitted by skilled nursing facilities. The state projected would see $246 million in gross budgetary savings because of savings. To date, we have not received any of the requested data, said Skilled Nursing News was told by the president of the New York State Health Facilities Association. It leaves nursing homes in New York in limbo. All right, so let me just see what's going on here. And this is why Medicare for all, and I just said won't work, because what's happening is they're saying all these savings we get from Medicare, we can extrapolate that to all forms of doctor services and physician services and hospital services. It's not going to happen, my friends. Do you really think that doctors are going to sit there if they get rid of private insurance where they're making their profits on, and they're going to sit there and going to say, yes, you can squeeze us and reimbursement rates? It's nuts. Medicare for all won't work because, yes, Medicare, as it is today, has significant cost reductions relative to what private practice insurance pays. If we get rid of private insurance and everything goes to Medicare, do you not think that the government is going to demand and will receive cost reductions from not only the providers, but for the hospitals as well? And do you think if you're a hospital and or provider, you're going to sit there and say, yeah, we'll just take it on the chin. No big deal. It's not going to happen. It's not going to happen. Medicaid, this is for poor people, is dying. It's all the way around that. Medicare is next. And to expand the program and to assume and insinuate, as these guys are doing, that the government will be able to squeeze the providers more and more to reduce their costs. It's fairyland, man. This is Alice in Wonderland stuff. It's not going to happen. So the number one thing you can do is pay off your mortgage, because that will be, if you need skilled nursing care and you need it through a long-term care facility, assisted living, or you need cost covered for whatever surgeries you need, and Medicare is squeezing people more and more, you can do it by selling your house. I mean, it's sad, but there's no other way around it. All right, we'll see you.